This video will guide you through the journey of your joint replacement and will help show you the key people and places involved in your treatment. We encourage you to look all around each room as you are watching, as the video is in a 360-degree format.
I've been asked to give you a little talk on what's going to happen during your procedure. Now, I don't know whether you've seen a consultant or not, but the first thing in the process obviously is you see the consultant.
Hi and welcome. So you decided to go ahead with joint replacement, so I need to tell you what's going to happen next. I will go through with you all the fors and againsts of having joint replacement in finer detail. For you to be 100% certain that you want to go ahead, then you need to know the things that can occasionally go wrong, problems that some people have, and also we need to make sure that we've reduced the chances of those things happening as much as possible.
Then usually most hospitals have what's called a hip and knee club.
Good afternoon. Welcome to the physiotherapy department. Come on through.
You go away ready then for the big day.
Hello, come on in. This is the operating theatre. So this is where your surgery will take place. Have a look around. I'll talk you through everything. Over here is Helen. She's got the instruments ready. I'll show you the kind of things that we use in theatre. Normally these would be sterile. I'd have gloves on whenever I'm handling this. This is a trial femur implant, which means the end of your thigh bone. First of all, we've got all these special jigs that we use to cut your shape for your new thigh bone, and then put this on the end, and then there'll be a similar thing for the top of your shin bone, your tibia, and then these are spaces that go between the two, and so on the table we can make sure that you've got the perfect implant that's going to fit you well and last you a long time. And then this is when I'm doing a knee replacement. It's the special computer that helps guide me as to making your leg as straight as possible and also using all the right instruments. Then I'd go and wash my hands and get ready for your operation.
So that's basically the surgery itself. From there, obviously, you have a little time in recovery in theatres where they check that everything's okay.
Hi, this is the recovery area. This is where you'll come when you've had your operation. And if you've been given a breathing tube, you may come into this area and not quite be awake enough to be breathing for yourself. Don't worry, we're here to do that for you.
Okay. And then you go back to the main ward. Once you're on the ward, then the rehabilitation process takes place. Physiotherapists come along and they start to get you moving.
You've had your operation. Hopefully we're going to see you very soon after you return to the ward. What we'll aim to be doing is the first time we get you up and out of bed, it'll be as soon as the anaesthetic has worn off from your leg and it's safe to do so. First time out of bed, all we're going to do is get you stood initially. Use a Zimmer frame, and hopefully that will give you the confidence to put a little bit of weight through your leg and start doing a little bit of the functional side of walking. We'll also be looking at giving you various pieces of small equipment like this tablet here. We can link this up to small devices that will enable us to remotely watch how your exercises are coming on. Very good technology.
Now that may take a few days before you're discharged, but they build up a range of movement that you can follow when you get home. As you go home, you take with you a bag, and in the bag you get these little devices. It is a tablet, and this is what's called a range of movement device. This you strap to the leg and you go through the movements that you're expected to do by the physiotherapist. This is monitored back at the hospital, so they make sure that A, you're not doing too much, and B, you're not doing too little. Because what they want you to do is to be able to bend your knee to get a good range of movement. And the only way you can do that is to follow the instructions they give you. Enjoy your operation, enjoy the future. Thank you. Hello! Hello! Hello, 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 hello. Wow, what are you doing? You're running around like a lunatic. Right. You have got to show me how to play this game.
Okay.
Because I'm not sure. Now I know you've got to slide this thing off. Yeah?
Like that?
Like that.
Freeze me.
Now you show me how it all works. Okay?
Okay.
Freeze.